Bismillahirrahmanirrahim. Today we are going to talk about the very most important topic, the blood pressure. What is mean by the blood pressure? Okay, the pressure of the blood which is exerted on the wall of the blood vessel. Again, what is blood pressure? The pressure which is exerted by the blood on the wall of the blood vessel is called, that pressure is called blood pressure. Very simply, as we know that, suppose suppose this is a pipe which is filled with water. This is a pipe which is filled with water. Then this water, H2O, this water apply pressure laterally outward on the wall of this pipe. So that pressure, this pressure is called the water pressure for this one pipe. Okay, water pressure. Okay, so what is blood pressure? The pressure which is exerted by the blood laterally on the wall of the blood vessel. That pressure is called blood pressure. Okay, suppose this is a right atrium, this is a left atrium, this is a left ventricle, this is a left atrium, this one is a left ventricle. Okay, and this one is the aorta, this one is the aorta. Okay, so as we know that our body consists of three types of blood vessel: the arteries, the veins, and the capillaries. So the blood is present in all these blood vessels. Okay, so when blood apply pressure on the wall of the arteries, on the wall of the aorta, arteries, arterioles, that pressure is called arterial blood pressure. And when the blood apply pressure on the wall of the veins, that pressure is called venous blood pressure. And the pressure which is exerted by the blood on the wall of the capillary, that pressure is called capillary blood pressure. Okay, but in clinical practice, the blood pressure which is count here, the arterial blood pressure or arterial blood pressure. Okay, so in clinical practice, this one is mainly used. Okay, so blood pressure is referred to the arterial blood pressure. Okay, so capillary blood pressure have its own importance, like the exchange of material. Okay, venous blood pressure also have its own importance, but the very most important pressure is the arterial blood pressure. Okay, so doctor consider the arterial blood pressure as the blood pressure. Okay, so in this class, I will only discuss the arterial blood pressure, but in the next class, I will discuss this. Okay, the venous blood pressure and CBP. Okay, so suppose what is arterial blood pressure? The blood pressure, arterial blood pressure, are that blood pressure which is exerted by the blood on the wall of the arteries is called arterial blood pressure. Okay, as we know that this is the aorta, these are the arteries which is branched from the aorta. These are the arteries, these are the arteries. Okay, the the blood pressure, the arterial blood pressure have two types: systolic blood pressure and diastolic blood pressure. Have two types: the systolic blood pressure and diastolic blood pressure. What is mean by systolic blood pressure? Systolic blood pressure is about 120 millimeter Hg, and diastolic blood pressure is about normally 80 millimeter Hg. What is mean by this one and this one figure, this one number? Okay, as you know that the blood is coming from the lungs, the oxygenated blood, and fall here. Okay, so the blood is accumulated here in the left ventricle. Okay, so what is systolic blood pressure? The blood pressure here, the blood pressure and the aorta, the blood pressure and the arteries, the blood pressure here, the blood pressure and the aorta, artery, arterioles. When the ventricle contract, that blood pressure is called systolic blood pressure. Systolic blood pressure are that blood pressure which is produced during the contraction of the left ventricle. When the left ventricle is contracted, this is the normal ventricle. relaxed ventricle. This is the normal aorta, the relaxed aorta. Okay, so when the ventricle contract, the here and the relaxed state, as we know that from my previous class, the big one class, the cardiac cycle, when the blood is coming here, this blood apply pressure about 8 millimeter up Hg. Okay, so when the ventricle is going and contraction, when the ventricle is going and contraction, the pressure is increased, is about the pressure is reached about 50 millimeter Hg, about 80, about 120 millimeter Hg. When the ventricle start contraction, here the pressure inside the ventricle is increased continuously and reached up to 120 millimeter Hg. Okay, so this 120 millimeter Hg pressure through this blood is transferred here, and this one, the aorta, now the aorta, now now the aorta is expand. The aorta is expand because this is the normal aorta, relaxed aorta. The aorta is expand because more of the blood is coming here. Okay, the aorta is expand because 120 there the pressure is going and increasing from 8 up to 120. So 120 of pressure through the blood is transferred here. Okay, so this pressure and this aorta and this point, this pressure is called systolic blood pressure because this pressure is produced. The aorta is relax, the aorta is expand. So this pressure at this point is called the systolic blood pressure because this blood pressure is produced here due to during the contraction. There during at this point the ventricle is in this. Okay, the ventricle is in contraction and contracted point. Okay, so that this pressure, that blood pressure, this blood pressure is called at this point the systolic blood pressure. Okay, when the aorta is again going under relaxation, the pressure is piling here continuously. Okay, so this is the aorta. The aorta is again going under relaxation. Okay, the aorta is again going under relaxation. The pressure here is continuously pile down, pile down. Okay, piling, continuously piling. When the pressure is reached about 80 millimeter Hg, 80 millimeter of Hg, there the aortic wall is closed. There the aortic wall become closed, and here the pressure is again reached up to 8 millimeter of Hg. Okay, so when the pressure is falling here, when the pressure is falling here, then the aorta is again come to its normal position. Aorta is again come to its normal position. So this 120 of pressure is transferred forward because the blood vessel, mainly the arteries, are elastic in nature. So there the aorta is expand, and this aorta want to maintain to attain its original size. Okay, so due to elasticity, this aorta is contract. When this aorta is contract here, so and when this aorta is going and contraction, then 120 of pressure is transferred forward to next point of the aorta or other part of the arteries. Okay, so 120 of pressure is transferred here and expand this area, expand this area. Okay, expand this area by 120 of pressure. Okay, so 120 of pressure, this systolic pressure is transferred here. Okay, so when the pressure is pulled down below the 80 millimeter of Hg, then this part is contain the blood which apply pressure about 80 millimeter of Hg. This part, this normal aorta is not completely empty by the blood. Okay, some amount of the blood is maintained here, some amount of the blood is retained here. So that blood, that pressure which is exerted here, that pressure which is exerted by the blood when the ventricle is relaxed, when the ventricle is relaxed, there are present some amount of blood, and this blood apply pressure. This is the normal aorta, this is the relaxed this is the relaxed ventricle. Okay, so there is about 8 millimeter of Hg. Okay, so and there the wall is closed, or aortic wall is closed here. So in this normal aorta, there are present some amount of the blood which apply pressure about 80 millimeter of Hg. That blood pressure is called diastolic blood pressure. What is diastolic blood pressure? Diastolic blood pressure are the blood pressure when the ventricle is in the phase of the relaxed state. When the ventricle is in the relaxed state, then the pressure here is called the diastolic blood pressure. Okay, so there the pressure, in the aorta is about 80 millimeter of Hg. Okay, so that blood pressure is called diastolic blood pressure. Okay, when the ventricle is again contract, when the ventricle is again going on contraction, when the pressure is reached about here the 80, when the pressure is increased from 80 about 82, 82, 81 or 82, this wall become open, and this wall when it become open, then 80 millimeter of pressure is transfer here. Okay, so there is about systolic blood pressure is here, and there is diastolic blood pressure. Okay, the diastolic blood pressure is transfer here, and there come the systolic blood pressure again, and this cycle is continues. Okay, so during this cycle, contraction and relaxation of the blood vessel is going on forward. This is the blood vessel. There is the relaxation 120. There is the 80. There is again the 120. Okay, because here produce 120 80. By the next jerk, here produce 120, and again by relaxation produce 80. Okay, so the contraction and relaxation through the blood vessel is going on forward direction. So that wave it produces a wave. That wave is called the pulse wave. The pulse wave. Okay, so what is mean by pulse? Pulse are the wave which is produced during the contraction and relaxation of the ventricle. So it produces contraction and relaxation in the blood vessel. Okay, so that wave is called pulse wave. That pulse wave is going in the forward direction, just like this one. 80, 120, 80, 120, 80, 120, 80. Okay, so this wave is called the pulse wave. Okay, so the systolic blood pressure is produced during the contraction. Here the pressure is increased about 120, and this 120 pressure is transferred here. Okay, so that pressure is called systolic blood pressure. When the ventricle is going under relaxation, some amount of blood is maintained here, some amount of blood is retained here. Okay, so that blood apply pressure, that pressure is called diastolic blood pressure. Okay, so these are all about the blood pressure. Another very most important point is the factors affecting the blood pressure. Factors that maintain the systolic blood pressure, factors that maintain the diastolic blood pressure. So there are two main types of factors. Two main factors which maintain the blood pressure. Number one, cardiac output and total peripheral resistance. These two factors mainly maintain the blood pressure all the time in the body. Okay, cardiac output and total peripheral resistance. Okay, what is mean by the cardiac output? Cardiac output maintained. The cardiac output maintain the systolic blood pressure, and total peripheral resistance maintain the diastolic blood pressure. Okay, so what is cardiac output? As we know that from my previous class, the big one class, the cardiac output. What is cardiac output? Cardiac output, the amount of the blood which is pumped out by the heart, that amount of the blood is called cardiac output. Very easy. The amount of the blood which is pumped out by the heart during the contraction, that amount of the blood is called the cardiac output. Okay, so this is my heart. This is the left atrium. This is the left ventricle. This is my aorta. Okay, the blood is coming here. The ventricle contract and that blood is pumped out. That amount of blood which is pumped out during the ventricular contraction, that amount of the blood is called cardiac output. Okay, this cardiac output mainly maintain the systolic blood pressure. Okay, so the cardiac output again depend on contractility, the preload. The cardiac output depend on contractility, preload plus contractility. Number one, number two. Okay, so what is preload? What is mean by the preload? The amount of the blood here, the amount of the blood and the ventricle before the ventricular contraction, that amount of the blood is called preload. Okay, suppose this is the ventricle is filled with the blood. So this is the relaxed ventricle, this is the normal ventricle. So this amount of the blood is called the preload. Okay, so what is preload? The amount of the blood and the ventricle before the ventricular contraction is called preload. Okay, the preload is again depend on the venous return. Number one, venous return. What is mean by venous return? The amount of the blood which is returned from the veins. Okay, which is returned from all part of the body. This blood is called venous return, which is returned to the left atrium, to the left ventricle from the veins, from all veins of the body. Okay, so when the venous return increase, when the venous return increase, this is a very simple concept. When the venous return increase, there the preload is increased. Preload increase. When the preload is increased here, it means more amount of blood is coming here. When the preload is increased here, then the large amount of blood is pumped here. Okay, so there it produce greater systolic pressure. Okay, so when there large amount of the blood, when their preload is increased, large amount of the blood is pumped here, so it produce more greater pressure. That pressure is called systolic blood pressure. So the systolic blood pressure is increased. Okay, so venous return is directly proportional. Venous return is directly proportional to the preload, and the preload is directly proportional to the systolic blood pressure. Okay, this is one factor. Another factor is the blood volume. When the blood volume in the body is more, then more amount of the blood is coming here. When the blood volume is increased in the body, large amount of the venous return occur. Preload is increased. Blood volume when increase, venous return increase. When venous return increase, preload increase. When preload increase, large amount of the blood is pumped here, and it increase the SBP. Okay, so systolic blood pressure is increased here, large amount of the blood is produced here, the greater pressure. Okay, another factor, the pelling pressure. Another factor, preload depend on another factor which is called the pelling pressure. When the pelling pressure is increased, when the atrium contract gratefully, with a greater pressure, with a nice pressure, large amount of the blood is coming here, preload is increased and systolic blood pressure is increased. Okay, when pelling pressure increase, preload increase, and when preload increase, large amount of blood is coming pumped here. Okay, so systolic BP increase. Okay, so directly proportional. Okay, another factor is the pelling time. What is mean by the pelling time? the time during which the ventricle is filled, that time is called filling time. When the filling time is increased, when there is large time, enough time through which this wall is open. Okay, so when this wall is open for large time, so the filling time is increased. When the filling time is increased, large amount of blood is coming here and large amount of blood is pumped here. Okay, so filling time, when filling time is increased, preload is increased because there is large time for opening up this wall. Okay, and large amount of blood is coming here. Filling time is increased, preload increased, and at increased SBP. Okay, another factor is the venous contraction. When veins at the periphery of the body is contract, as we know that this is the veins, this is the vein. The vein is filled. Large amount of the blood in the body is is present in the veins because veins are least elastic, and this vein is filled. Okay, so when the veins contract, the blood is coming here. Okay, so when venous contraction increase, more amount of blood coming is here, venous return increase, preload increase, and SBP increase. Okay, SBP increase. Okay, another factor is the venous dilation. When the venous dilation occur, this amount of blood is coming here and it decrease. Okay, so venous dilation is inversely proportional to the SBP. Okay, this is inversely proportional, this is the directly proportional. Another most important topic, most important point in clinical practice, the heart rate. Very most important factor, heart rate. What is mean by the heart rate? The number of contraction and relaxation in 1 minute is called heart rate. Normal heart rate is about 70 beat per minute. Okay, so when the heart rate is increased, the SBP, the systolic blood pressure, is increased up to some limit. Suppose during exercise, the heart rate, this is a normal condition, during the normal static condition. Okay, so during exercise, uh, during strong exercise, the heart rate is reached about so beat per minute, or about 95 beat per minute. Okay, so here the blood pressure is increased, the SBP increased, because when the heart rate is increased, quickly the ventricle contract and relax. Okay, so it increase the SBP, the systolic blood pressure. Okay, when the heart rate is increased more, like when the heart rate is reached about 130, 121, 50, it decrease, at sudden fall down the systolic blood pressure. Okay, because when the heart rate is extremely increase the heart rate. Okay, it decrease the blood pressure. It is because the timing is decreased, there the filling time is decreased. Okay, so there is no more time, and order there is no more time for the ventricle to fill with the blood. Okay, so there the filling time is decreased by the ventricle, so during extreme heart rate, the blood pressure is decreased because the filling time is decreased, the filling time for the ventricle is decreased. Okay, so this amount of blood is coming here and less amount of blood is pumped here because time is very decrease, very least time here. Okay, so this is very most important factor. Slight increase, note this one point, slight increase and slight increase in heart rate increase the BP, but extreme increase in heart rate decrease the BP. Okay, so these are all the factor which maintain, which control the systolic blood pressure. Okay, another factor is contractility. When the heart is contract greatly, the BP is the normal. Okay, BP is increased, so this is the contractility. The total peripheral resistance. Total peripheral resistance is the factor which maintain the diastolic blood pressure. This is the only factor which maintain the diastolic blood pressure. Okay, what is mean by the total peripheral resistance? This is a resistance of the arterioles. This is the resistance of the arterioles to the blood in order to flow from the center of the body to the periphery. Simply, very simply, as we know that. Suppose this is the aorta. This is the heart. This is the okay. This is the aorta. These are the arteries. Suppose these are the arteries. These are the arterioles. Okay, aorta, artery, arterioles, and these are the capillaries. These are the capillaries. Okay, these are the capillaries. At this point, there present a ring which control. There present. Sorry. At this point, this is the. These are the capillaries. At this point, there present a ring which control the flow of blood from the arterioles to the capillaries. These are the capillaries. Okay, so at this point, what is mean by total peripheral resistance? When this ring contract, I do not allow more blood to flow from the arteries to the capillaries. Okay, so when the total peripheral resistance increased, when the ring contract, when the total peripheral resistance increased, more amount of the blood is maintained here. Okay, so it increase the diastolic blood pressure. Before this one, their diastolic blood pressure is about 80 millimeter of Hg. When this ring contract, and less amount of the blood is go from the arterioles to the capillary. Okay, so here maintained large amount of the blood, so it increased the diastolic blood pressure. Okay, so what is total peripheral resistance? Total peripheral resistance are the resistance which is upper to the flow of blood from the center to the periphery of the body. Okay, when the ring relax, here large amount of the blood is flow from the arterioles. This is the arterioles, and these are the capillary. Okay, so here the total peripheral the resistance is decreased because of large ring, and there the diastolic BP is down about 70. Okay, so the diastolic blood pressure depend on total peripheral resistance, and the systolic blood pressure depend on the preload cardiac output is again depend on preload contractility. Okay, so these are all about the blood pressure and the factor for the blood pressure. Okay, so in the next class I will explain the venous blood pressure and the capillary blood pressure and its importance. Okay, so stop. Sorry, one point. After this hard working, I request you to subscribe my channel, like my channel, and good comment on me. Okay, so this is my request. This is humbly request to you to subscribe my channel.